Hello, this is Dr. Shailaja Pisabati, myself. I'm a clinical psychologist. Today the topic is like OCD, Obsessive Compulsive Disorder. It's a chronic neuropsychiatric disorder. This includes a broad range of symptoms and various psychological domains. That is, perception, cognition, emotion, social relatedness, and sometimes, motor behaviors as well. So this chronic condition, it affects 1 to 3% in the general population. So usually we see in our clinics, people do come with four major, OC symptoms. So first is like symmetry obsessions, like counting, ordering, aligning things, arranging, such kind of compulsions we see. So the need for the things to be perfect, just exactly the way symmetrical kind of compulsions we do observe in this. Next is forbidden thoughts, intrusive thoughts, disturbing thoughts, negative thoughts, unwanted thoughts would be usually. So these are, may sometimes the patient feel shame and embarrassed to share also, because they are persistent, intrusive in nature, and sometimes that are often like violent or sexual also. Next comes to the contamination and cleaning. So there is a constant or extreme fear of getting exposed to bacteria or germs, and so in this the excessive hand washing, self isolation, avoiding touching the things or people, all this we observe. Next comes to hoarding. So some of the characteristics of people who have this kind of compulsion, or they usually being unable to let go of things that are not useful anymore, and they form strong emotional attachments with inanimate objects, and also difficult making some simple decisions also. They feel refusing to let people come into their home because due to shame, or feeling embarrassed and all that. So studies have actually suggested that the OCD usually has the genetic influence, genetical factors influence. Not only just genetical factors, there could be some brain abnormalities and deep structures of the brain it is involved. So there are some neurochemical imbalances also. Sometimes the stress, the environmental factors play a major role in causing such conditions. Whenever any patient come with the OCD, we do see that they are diagnosed with some other mental health conditions also, that is called the comorbidity, we call it as. These are comorbid disorders. So they have some other mental health issues also. When we have seen the research studies and all that, in the research studies it is evident that generalized anxiety disorder, GAD we call, panic disorder, agoraphobia, and other recurrent major depression, these are all conditions aggregate the OCD, aggregate with OCD. So why this is like, they have the shared etiological elements between these disorders and OCD. When we come to the age of onset of this OCD, it's not like there is no age, the particular age, the individual do have this OCD, begins usually in childhood and adolescent, because if any child is associated with these kind of behaviors and all that, over a period of time it gets worsen. So OCD has the severity, it varies in childhood, adolescent, or adult. Usually it begins in the teenage, and as it can start in childhood also, but it simply this usually begins gradually and tend to vary in severity throughout the life. And the kind of compulsions or the obsessions the individual experience can also change over a period of time. And this symptoms generally worsen when you experience greater stress in OCD. Coming back to the treatment methodologies and all that, how the treatment, many of them they don't know, they lack awareness of how it gets treated and all that. Usually there are two ways of treating, and based on the severity and condition, first you should visit a clinical psychologist for proper diagnosis of the condition. So after getting initial screening and all the assessments being done, the diagnosis will be after getting diagnosed, maybe based on the severity and all that, pharmacotherapy. The first line of treatment would be the pharmacotherapy, and then psychotherapy. So sometimes it is mostly, because most of the cases we do see that the combination of it works very effectively. Coming back to the little about the psychotherapy as a clinical psychologist, so here what we do in psychotherapy, we try to work to improve their biological functioning. And so the different approaches we do use, and we always do in a structured way of working with the clients. And CBT is it is also a type of psychotherapy which is very effective for the people with OCD. And apart from CBT, exposure and response prevention therapy, it is called ERP, and it is a component of the CBT therapy only. Generally, it involves gradually exposing you to a feared object or obsession. It could be a dirt, or learning ways to resist the urge to do your compulsive rituals. So ERP, it takes a lot of effort, time, practice and all that, but you may definitely enjoy a better quality of life once you learn to manage your obsessions and compulsions. So I hope this video has definitely given the overview and understanding about the symptoms, causes, and also the treatment about the OCD. And if for further help, I want if you are, or if you are any of your known people suffering, educate them and get treated well, in a proper way. Do not neglect the mental health issues. Thank you very much. Hope this video is maybe useful for you. Thank you.